So a lot of people ask us, how long does it take to take care of wisdom tooth? Let's have a look at this one. I would say maybe around the 5-10 minutes mark, but we'll see. How we do things differently in our practice, where we obviously examine whether this patient needs wisdom tooth removed. We check the medical history, that's all fairly basic. But the second thing we do, very importantly, is to take what we call a CBCT. Based on the scan, select the wisdom tooth that we wanted, and examine where the nerve is, where the artery is, where the nerve is coming out. We can't avoid hitting nerve or cutting any sort of anatomical structures. When, for example, a nerve that has been accidentally cut, that could potentially cause what we call partial paralysis or permanent paralysis. So this is something that we want to avoid. Done. Good job. Good. How can we minimize our surgical time and minimize trauma on the patient is based on the proper records, CT scans, and obviously knowing your anatomical structures, physics side of things, where you should be approaching, what's the easiest way to get the tooth out. So that all comes down to obviously experience and lots of planning and the technology you have.